The home care guideline measures for COVID-19 patients issued by the Kenyan Health Ministry has yielded positive results in the fight against the coronavirus pandemic. The new guidelines were introduced to limit the pressure on the healthcare system when the number of symptomatic cases continue to increase. As we feature in this report, a COVID-19 patient explained her journey to recovery while receiving home care treatment.
At her B&B business in Kenya's capital, Nairobi, owner Geritich says back on her feet after testing positive for COVID-19 2 months ago. After experiencing symptoms, she isolated herself for a week before taking a COVID-19 test, which came back positive. After consultations with her doctor,
we said, let's go into home-based care because my symptoms, although quite severe, did not involve that loss of oxygen.
Geritich says her family played a key role in her journey to recovery. Guidelines issued by the Ministry of Health allow family members to act as caregivers alongside community health workers. Geritich's symptoms persisted for 3 weeks.
Second test came back positive. And so when I spoke with my doctors, they said it's entirely the case that you're still symptomatic, you're still coughing, you're not completely unwell. So you're one of those unfortunate cases where it's just lingered.
She admits it wasn't easy on her mental health.
I remember often not being sure whether I was awake or asleep or even alive or dead, so that anxiety kicks in.
The home-based care system was introduced in June to relieve pressure from the health system after a rise in asymptomatic cases. At the time, at least 78% of those who tested positive for COVID-19 were asymptomatic cases.
One of the things we realize is that when you're within your home environment, it is much easier for you to recover much faster. You receive much more personalized care. You receive much more nutritious supplementation in terms of feeding. And as well, you receive the love and care that you receive from a family.
Now fully recovered, Geritich says, contrary to what many think, home-based care is expensive, but she would much rather recover at home than in a hospital.
My recovery at home was a lot easier than it would have been if I was in hospital. As I mentioned, I kept testing positive. Imagine what that would have meant for my mental health if I was in hospital.